Welcome to a new series of YouTube videos focusing on best practices in the area of supply chain management in the emergency and humanitarian contexts. The video series is made possible through funding from USAID Bureau of Humanitarian Assistance and a project implemented by JSI Research Training Institute Incorporated, in collaboration with Alight Rwanda. We are very pleased to be hosting this video series. We know that you do a lot of work, and we hope that the videos that we present in this series will contribute to your knowledge and skills and show some practical solutions that have been applied by others and that may be useful to you in your work. By the end of this video, we hope that you'll have a clear understanding of the need for logistic data in supply chain management and how data can be collected and shared, and how Paper LMIS can help you as a data collection and management tool. We want to start with a quick definition of what an LMIS system is. Essentially, it is a system for collecting and communicating the logistics data that we need to operate our supply chain effectively. A good LMIS will ensure that data is available when and when it is needed for decision making. We typically talk about and try to collect at a minimum the three essential data items shown here: stock on hand, consumption, and losses and other adjustments. A good LMIS is made up of both records to collect data and reports to communicate data. We have consumption records, transaction records, and storekeeping records to collect these types of data indicated here. And we have both summary reports and feedback reports that move data and information up and down the supply chain. In this series, we'll be featuring Alight Rwanda and how they've been using Paper LMIS for logistic data in supply chain management.
Since 1994, Alight has played a critical role in rebuilding lives and responding to crises in Rwanda. Today in Rwanda, we are a core partner to the United Nations as well as the government of Rwanda. We lead the bulk of responses, care and support for the nearly 150,000 refugees in Rwanda. And our responses cover health as well as protection, as well as provision of safe water, hygiene and sanitation.
In Rwanda, Alight provides comprehensive healthcare services in the Congolese and Burundian refugee population through curative and preventative primary health care. As of July 2021, Alight provided healthcare services to the total population approximated at 75,000, located in the refugee settlement camps of Mahama, Gihembe, and Nyabiheke. The camps are located in remote areas away from the central city of Kigali, where facilities and resources are limited. Prior to Alight's introduction of standardized inventory management practices, reporting was disjointed and sporadic, resulting in suboptimal supply chain outcomes. Alight Rwanda has used various tools to capture data and enter it into the LMIS. In this video, we'll review some of those tools and get to understand at which levels these tools are used. The stock card captures receipts and issues at all levels. The transfer of issues from upper level to lower level is performed with a waybill, recording items requested by a monthly report and a requisition form. The receipts at the field store are recorded with a stock card, released with a weekly requisition form, and transferred with a waybill. At dispensing level, receipts are recorded on a stock card and are released with an internal requisition form and on medical prescription form. Vital and urgent items that may not be available in normal supply chain channels are directly ordered with the order form from contracted suppliers. A light stock card is a tool that pharmacists and storekeepers use to capture all essential data. This includes stock on hand, which is captured by balance entry, consumption data, which is captured by receipts and issues, and stock levels, which are captured by months of stock in relation to program minimum and maximum stock levels. Pharmacies use the weekly requisition form to place orders based on the consumption data captured on the stock card. Like the stock card, the requisition form captures essential data including stock on hand, consumption data, and stock levels. These data are used to calculate ideal order quantities in order to maintain adequate stock levels. They are also used to measure supply chain performance through the order fill rate indicator captured by the quantity received data point. The monthly report and requisition form captures the opening stock, which corresponds with the end of the previous month's physical inventory data that is captured on a stock card. It also records the monthly consumption, which is captured with the internal requisition form and a prescription form aggregated on a weekly requisition form and also captured on a stock card. This enables forecasting the quantity to be ordered for the next month. Let's now look at the innovations and how the Alight team is using the tools.
Drugs, like other health commodities, are considered restricted goods. That means the procurement process may take a long process that involves approvals and other pipeline issues. In the situation of emergency, when it can take long for us, we have our internal policies that can help the processes to move quickly to access the availability of that medicine. One example is the framework agreement that RIT has put in place and which are supported with the other LMIS tools.
Ariko hari n'ahandi natangiye ariko hano ho maze imyaka ine nuvuga ngo ikigenda gihinduka ngendeye kuko twatangiye tutagira fiche de stock, tutagira izi turuzi ibitabo dusabiramo imiti tuyakiriramo tuyitangiramo, ariko ubu ngubu rwose igishya gihari nuko dufite ibitabo dusabiramo imiti, tukagira ibyo tuyitangiramo ijya mu maserivisi, tukagira n'impapuro abarwayi baza gufatiraho imiti bavuye mu masuzumiro, hakabaho na nyuma y'ibyo byose tugakora na raporo y'ukwezi igaragaza imiti twakoresheje kugira ngo ubutaha farumasi nkuru yacu ibashe kuduha imiti yindi tuzakoresha mu kindi gihe runaka.
The framework agreement, as it says itself, it is a form of procurement where RIT engages directly with the pharmacies, and you can get medicine directly from pharmacies without going through the normal procurement processes. At my level, when the urgent need of medicine is presented from field site, I directly fill the order form and get the medicine for our patients. For example, when we have implemented this framework agreement and the corresponding order form tools, the read time has improved drastically from, let's say, 2 weeks down to 48 hours. This is something interesting. The supplier-buyer relationship has improved. We have gained a good relationship with our suppliers, and the value for money has improved through this agreement. We are purchasing at low prices, at reasonably low prices. And also, if you can visit our field site, you can see that the morale for our health staff and the customer satisfaction has improved. So we thank so much this process that has been put in place.
I'm recalling the tools such as the order form, which is an innovation as well, which was not there before, and to ensure that our processes are done on timely, we thought of putting in place this order form when purchasing prescribed medicine, so that as I told you, we have framework agreement, but framework agreement itself doesn't solve the problem. We have to have other tools that will help us to implement those framework agreements.
It also means then that as leadership and working closely with our pharmaceutical teams, as well as the health teams, we have in place waivers that allow timely decision making and movement for proper supply chain management.
With the onset of the pandemic, Alight has had to adapt their systems in response to the challenges posed. All of the purchasing, record keeping, request forms, and documentation for medication to resupply pharmacies and facilities were done manually on paper pre-COVID. Trips to exchange information were happening to and fro from the pharmaceutical field stores on a monthly basis, and from the field store to the refugee camps on a weekly basis. This proved to be an incredibly efficient system with the ability to monitor stock consumption and respond quickly to trends. However, COVID posed a challenge with travel restrictions limiting movement for procurement and distribution of products. The Alight team, quick to think on their feet, adapted their system to expand the pool of suppliers to withstand changes to market price, ensure adequate stock levels, and adjust order quantities to accommodate for 3 months of supply. They also went digital with electronic versions of tools submitted via email and leveraging on digital platforms, including WhatsApp, Zoom, and Skype for communication, and to conduct meetings to keep up with reporting and to ensure that data is still made available for adequate resupply. The video series is presented with the support of the USAID Bureau of Humanitarian Assistance through building capacity to improve pharmaceutical and medical commodity management in humanitarian and disaster setting project, which is managed by JSI R&T. The goal of this project is to build the capacity of staff working with humanitarian organizations, including international organizations and local NGOs, to manage pharmaceutical and medical commodity supply chain in humanitarian settings by equipping them with resources, guidance, training, and follow-up support. We hope that this and our other videos will help contribute to that goal.